Hello guys, greetings to all. This side Dr. Vishwajit Singh, your faculty for Forensic Medicine and Toxicology subject in DBMCI. And in this session of YouTube, our whole target will be to discuss few very important MCQs. And with the help of MCQs, the respective topics targeting our PG exams. And this session will be beneficial for FMG exam aspirants too. So we will be discussing high yield MCQs. Along with the MCQs, my aim will be to revise those topics for you all. So let us begin our session with question number 1. Asked in one of the recent exams. A person Ram was arrested by police for alleged murder of a woman who was found dead with incised stab wound in a park. Another person, Shyam, was presented as public witness by prosecution. Prosecution tries to give justice to the victim. Who is the victim here? The female whose death has occurred. This witness, Shyam, says in the courtroom that he saw Ram killing the woman with a knife. What type of evidence is being given by the witness, Shyam, in courtroom? The correct answer goes with, yes, this is what is direct evidence for us. Solve this another question and then we will discuss this topic. Another question for you. There is a victim B who was found dead with incised stab wound over chest with crime scene images shown to you. Okay. Now a victim is present with wounds with the weapon knife can be seen over here and blood stains can be seen. Now during recording of evidence of this case of a person C as a public witness in courtroom, what this witness tells in the courtroom, that victim B was running and saying that accused A will kill him. Now this witness has not seen the actual crime, but he had heard something from the victim that yes, he is going to be killed by someone. At what time? Just few minutes before death of the victim. What is correct about the evidence given by C? These are your 4 options. Now this won't be direct evidence, correct? Direct evidence is usually acquired by common witnesses or eyewitnesses. Who are common witnesses? Common witnesses are witnesses who have actually seen the crime occurring. So option A can be ruled out. Yes, this is not a common witness, but he has heard something in relation to the crime from the victim itself, just before the death of the victim. So yes, these are indirect evidences. But we have options in the form of res geste admissible in courts, hearsay evidence admissible in courts. Now what will be your best answer? Now the best answer goes with option C. Now to solve this question and any such question in future exams, we should be very sound in this topic of what are the types of witnesses, what are the types of evidences. So we will draw a flowchart, a simple flowchart to solve any such questions. So if I have to divide this topic of evidence, I can divide it into direct and indirect evidence. And these evidences, direct and indirect evidences, they are usually acquired by witnesses outside courts. So I can write, yes, these evidences are acquired outside courtroom during the process of the crime. And direct evidences are acquired by common witnesses. Who is a common witness? Eyewitness of the case. Who is the eyewitness? The person who has seen the crime occurring. Then direct evidences can also be acquired by expert witnesses. Who are expert witnesses? Any witness whose findings in relation to a case is admissible in honorable courts becomes an expert witness for the case. So these witnesses, they acquire which type of evidence? Direct evidence. A person who has seen the crime occurring, common witness, and they will always have which knowledge? Common witnesses, first-hand knowledge. And common witness is defined in 118 section of Indian Evidence Act. On the other hand, expert witness is defined in 45 section of Indian Evidence Act. And a person of any age can become common witness. There is no age as such a bar. Age is not a bar. The final maturity of understanding, like for example, suppose I say that there is a 5-year-old kid and he says, I have seen my father killing my mother. Can this 5-year-old child become a common witness or eyewitness of the case? Yes, as far as age is concerned. When that child will go to courts the judge will try to decipher the maturity of understanding of the child, whether he is able to understand, whether he has that maturity of understanding or not. As far as age is concerned, any age person can become a common witness, and they will always have first-hand knowledge about a crime. Why? Because they have seen the crime occurring. Which type of evidences they acquire? Direct evidence. Clear? Now come to indirect evidences. Indirect evidences, on the other hand, can be divided into circumstantial, something which has been seen in relation to a crime. So basically these are evidences seen in relation to a crime, and usually these are admissible in courts. They are admissible in courts. Another type of indirect evidence is hearsay evidence, something which has been heard in relation to a crime. In a simple way I can write now, something which has been heard in relation to a crime. But all our laws have been made by Britishers. All the IPC sections in 1860, CRPCs in 1861, and Evidence Act sections in 1872. Britishers have gone, but we are following the laws made by Britishers, and time to time we make some changes in our Indian laws. But the root laws made by Britishers are being followed. So Britishers told us that yes, hearsay evidence will be inadmissible in courts, and we are following this. Because courts stand as, we don't believe on heard things, but we will believe on heard things in certain situations. So those situations will become exceptions. Those situations will become exceptions of hearsay evidence, and these exceptions will be admissible. And these exceptions are anything which is heard at the time of death or near to the time of death. So at the time of death, suppose there is a term called res gestae. What is res gestae? A person is running and saying that he is going to be killed. This was heard by someone. This is what is res gestae. And this is an involuntary act. This is involuntarily made by the person out of panic, out of fear of death. So this is an involuntary act or exclamation made by a person who is about to die. And courts, what is their stand? The court's stand is, at the time of death, it is very unlikely that a person will speak lie. So that is why res gestae is admissible. Another exception is dying declaration. Now what is dying declaration? The statement of a dying person was recorded by someone. The statement becomes, that documentary evidence becomes dying declaration. But this is made voluntarily by the dying person, that to whom you can make your dying declaration, best if recorded by a magistrate. But many times magistrates are not available when the person is about to die in the hospital. So doctors can also record. If the person is dying in the village setting, village headman can record, or any person can record. So dying declaration is a statement recorded at the time of death. But this is voluntary statement made by the dying person. Again, it is admissible. It is also a heard evidence. You have heard the statement of a dying person and you have recorded it. So dying declaration is a documentary evidence when that document will be produced in the courts. But res gestae will remain a oral evidence, because the witness will come to courts and will tell that yes, I have heard this thing from the victim. Correct? So which hearsay evidences are admissible? Res gestae and dying declaration. As such, hearsay evidence or heard evidences are inadmissible. So this is how evidences are classified outside courts. Inside court, when the witness goes, inside court, I can divide these evidences. When the witness comes inside court, yes, evidences can be oral evidence or documentary evidence, which has a higher weightage. Obviously oral evidence. Why? Because cross-examination of the oral witness can be done. Cross-examination can be done. Now, if you have this theory in mind, are these questions tough questions? They aren't. Now, look at this question again. When the witness has seen the actual crime happening, the witness becomes a common witness, and I will recall that common witnesses acquire which type of evidence? Always direct evidence. In the same question, if I say that this witness saw Ram with a knife running behind of the female and later on the female was found to be dead with inside stab wound. He has not seen the crime occurring. He has seen the accused with a knife running behind the victim. What is this evidence? This is indirect evidence. To be exact, which type of indirect evidence? Circumstantial. Then I say that this witness, Shyam, he heard the female running and saying that I will be killed by this fellow. Please save me. This evidence is a heard evidence. But to be exact, which type of hearsay evidence? Res gestae. So now the better answer will go with res gestae. This is how you have to pick your answers in the actual exams. Now coming to this question. This is a question framed in a tougher way. The options are tougher. But if we know the basics that yes, res gestae is one of the types of hearsay evidence which is admissible in courts. I will mark this as the only answer. Because we know hearsay evidences as such are inadmissible in courts, and here the evidence which is acquired by the witness is a sort of hearsay evidence, to be exact res gestae. So better answer will be option C. Correct na? So don't mark any question wrong from this aspect. Witness and evidence are very important topics from legal procedures aspect. Now try to answer this question. Asked in one of the recent exams. PCM was branded as 650 milligram. On the strip it was labeled 650 milligram. But the drug was not producing the effect, and somehow some testing was done. It was found that the tablets, they are not of 650 milligram, they are actually of 250 milligram strength. And with regards to Drug and Cosmetic Act, earlier this act was first time made in 1940. Time to time many changes have been done year wise, and the last major change was done in 2008. So right now the Drug and Cosmetic Act is Drug and Cosmetic Amendment Act 2008. What you will call this drug as? If it was, the label was mentioning 650 milligram, but the actual concentration or strength of the PCM is 250 milligram. The correct answer goes with option C, misbranded. This is misbranding. This is mislabeling in a simple way when the label is wrong. Then I say that the strip was mentioning as PCM 650 milligram, and on testing, instead of PCM, it was found to contain ibuprofen. It was not containing acetaminophen. What is this drug I am talking about? This is what is spurious drugs. Now your answer will go with spurious drugs. Then I say that the label was of PCM tablet. It was mentioning 650 milligram. PCM was there. But along with PCM on testing, PCM was found, this tablet was found to contain some putrid thing. Putrid means dirty, or some toxic agent, or any decomposed thing was present in the constituent of the tablets. Which drug I am talking about? Which type of drug is called? What do you call this type of drug as? Adulterated drugs. Got the difference? So basically section 17, 17A and 17B, they define misbranded drug, adulterated drug and spurious drugs with respect to Drug and Cosmetic Act. And one more question was asked in INI-CT exams. Unethical drug, there is no such name called unethical, that is just a hypothetical option. These are the names which have been classified in the sections of this act. Okay. Then in Western countries they use a name called counterfeit drugs. Legally speaking, in India, none of the acts or rules with respect to drug and cosmetics, they don't deal with counterfeit drugs. This is a term not used in Indian setting. That is used in other countries. In India, we use misbranded drugs. What we mean by misbranded? When there is a falsity in the labeling. If something else is present, label is of PCM and something else is present as a different constituent, that is a spurious drug. Adulterated means PCM is there along with some toxic agent, putrid agent or decomposed agent. The drug becomes adulterated. Okay. Then in INI-CT exam they asked what is the minimum punishment for death due to spurious drugs or adulterated drugs. So So if someone is consuming spurious drugs and death of the patient occurs, now the minimum punishment is 10 years. 10 years was not in the option of the exam, and that is why the answer there was life imprisonment. But remember like this, minimum punishment is 10 years for death due to spurious drugs. Maximum can extend to life imprisonment plus fine provision. Fine provision is also there from the accused. Okay, so these are punishable offences. Why was this act formulated? To regulate import, manufacture, distribution and sale of drugs, and to control quality, purity and strength of a drug. This aim was also asked in old All India exam question. Okay, to control quality, purity and strength of a drug, and to regulate import, manufacture, distribution and sale of drugs, as well as cosmetics. We have this Drug and Cosmetic Act, and after this act was made in 1940, drug and cosmetic rules came into existence in 1945, according to which our drugs were divided into various schedules, out of which there is one very famous question, VIP question asked 100 times. The drugs have been divided into various schedules, which we have covered in our classes. The most important schedule to be remembered is Schedule H, which deals with which drugs? This deals with prescription drugs. Always remember, prescription drugs to be sold on the prescription of a registered medical practitioner only. And these drugs have on their label, they have this thing mentioning on their strip warning, and then they write to be sold on the prescription of a RMP only. And these are the drugs which contain a red strip on one side. So you will come to know that yes, which drug we are talking about is prescription drugs. And to be exact, H1 deals with prescription of antibiotics. So various schedules are there. The most important one is Schedule H. Asked 100 times. Let us move on to next question. Now this is also a repeatedly asked topic and question. A 25-year-old patient comes to casualty with history of unknown poisoning by some seed or drug. On examination, the patient presented with some features like dilated pupil, dry mouth, complaints of anuria. Which poisoning should the doctor suspect? Out of the following option, the best answer goes with Datura. Used as for religious purpose in many households for Lord Shiva. So this Datura looks like this, na? It looks like this, something like this. Single fruit with long spikes, single round fruit with long spikes over the surface. That is why the name used to denote Datura is thorn apple, one of the common names. Then it is also called railway platform poison or road poison. Why? Because it has got a stupefying nature. Stupefying nature means the person will become unconscious if someone consumes about 50 to 60 seeds of Datura. If it is mixed to someone's drink and given to the person, yes, the person will become unconscious for a while, and then he will be robbed of his valuable items. That is why it is called railway platform poison or road poison. Now, what is the active principle of Datura seeds? Active principle of Datura seeds is atropine, hyoscine and hyoscyamin, which we know. So if someone consumes Datura seed, about 50 to 60 seeds will lead to stupefying nature, and the signs and symptoms of poisoning can be there. This is the stupefying dose. Just double it. 100 to 120 seeds is the fatal dose. FD for fatal dose, not fixed deposit. Fatal dose. So here you should remember the fatal dose. There are few poisons where fatal dose is important. One of them is Datura. Okay. Now what will happen to the person? All the features of atropine excess in the body, all the secretions will get dried up. Salivary secretions will get dried up. The person will get dry mouth. The person will have dry, hot skin, dilated pupil, dysphagia, dysarthria, delirium, drowsiness, dysuria, painful urination, which can further progress to anuria, okay, because of decreased secretions. So yes, gradually the patient will show you all the features which are usually starting with D alphabet. So we say D of Datura goes with signs and symptoms of Datura, and the person will have a drunken gait because of the stupefying nature. How will you treat the person? What will be the antidote? IV physostigmine. Physostigmine is a reversible acetylcholinesterase inhibitor. It will inhibit that acetylcholinesterase enzyme so that acetylcholine levels increase in the synaptic cleft at neuromuscular junctions, and so that excess of atropinergic effect is countered and the patient gets benefited. Neostigmine is not preferred. Why? Because it is not able to cross blood-brain barrier. So these are the most important things to be remembered in Datura. This is one poison which you should never leave. It is asked almost in every exams, be it PG exams, be it FMG exams. Everything about Datura is important. Now try to answer this. Asked in one of the recent exams. A new topic, new area of fingerprints was explored in one of the recent exams. Fingerprint changes in relation to systemic diseases. Let us see and let us revise. Pattern option A says, column number, this left sided column, what is written in A is pattern is written but change in distance between the ridges. Yes, this goes with acromegaly. Along with acromegaly, we have covered this table time and again in our classes. Acromegaly, infantile paralysis and rickets. I for infantile paralysis, R for rickets. So whenever A for acromegaly, I for infantile paralysis, R for rickets is there will be change in distance between the ridges. Easy to remember like this. Complete loss of pattern, C for complete loss and C for celiac disease. Celiac disease. So B is matching with 3, A is matching with 1. Incomplete ridge atrophy goes with dermatitis, option number 2 over here. So this goes with 2. Permanent loss of fingerprints occur in leprosy. Along with that, radiation and electric burns. This we know already. So leprosy, radiation burn as well as electric burn. So here I can write number 4. Ridge alteration occurs in certain systemic diseases like scleroderma, where SCL70 autoantibody is formed. Along with scleroderma, what we should remember is skin eczema and atrophy. They can also lead to ridge alteration, skin eczema and atrophy. Along with this, remember acanthosis nigricans. Acanthosis nigricans. So here I can write number 5. So the correct sequence is 1, 3, 2, 4, 5. 1, 3, 2, 4, 5 goes with option D. D is the correct answer. This is how INI-CT exam questions are prepared. You have to select the correct option and then you have to mark it among A, B, C, D. Okay. So do a quick revision. Pattern is written but change in distance between ridges due to air in between ridges. A for acromegaly, I for infantile paralysis, R for ricket. Complete loss of pattern with ridges atrophy, C for complete, C for celiac disease. After C comes D alphabet. Dermatitis will lead to incomplete ridge atrophy. Permanent loss occurs in leprosy, electric and radiation burn. Ridge alteration occurs in scleroderma, acanthosis nigricans, skin eczema and atrophy. Done. Next question. Fingerprint. Now this is also a VIP topic, fingerprints. Identification of fingerprints. When do fingerprints appear? Like, what will be the answer to this question? Fingerprint ridges first appear by. They first appear by 4 months. Always remember, 4 months. Easy to remember like this. And they develop by. This happens during the fetal life. They develop by 6 months intrauterine life. All this is happening in intrauterine life. Appearance or startup of ridges development over fingertips. They start at 4 months and they finally develop, or their development is complete by 6 months. Easy to remember. 4 months will be how many weeks? 4, 4, 16. So best answer will go with option B. Suppose the question is fingerprint ridges develop by. Fingerprint ridges develop by 6 into 4, 24 weeks. 24 weeks. Okay. So best answer here in relation to, suppose they ask fingerprints develop by, goes with this one, 24 to 28. Okay. Now come to this question. asked in one of the recent exams. A 35-year-old patient of chronic arsenic poisoning has come to hospital. The doctor will notice which of the following clinical features in the above case. These are your 4 options, 1, 2, 3, 4, 5. Pick the true statements and then you have to mark it from A, B, C, D. So yes, chronic arsenic poisoning can give rise to aldrich meseline formation. This is a true statement. It can give rise to hyperkeratosis picture as well as raindrop pigmentation due to deposition in the skin. When this arsenic, in chronic arsenic poisoning, what happens? Arsenic is redistributed from blood to skin, hair, nails and bones. In skin, it leads to hyperkeratosis, raindrop pigmentation. In nails, it leads to white transverse lines over nails. Transverse line means the lines will be like this, transversely arranged over nails, called aldrich meseline. Yes, it gives rise to asymmetrical sensory motor neuropathy, or we say peripheral neuritis. That is correct to say. Luminous vomiting is seen with phosphorus poisoning. Wrong here. And when it gets deposited in bones, it will lead to bone marrow depression and can lead to pancytopenia. So this is also correct. 1, 2, 3 and 5. Option C goes as my best answer. Correct. What is the treatment of choice for arsenic poisoning? Always remember intramuscular injections of British anti-lewisite. British anti-lewisite is also sometimes called dimer-caprol. Why this British anti-lewisite is very effective? Because this ball contains unsaturated sulfhydryl groups. This arsenic is in love with sulfhydryl group of enzymes. We give something from outside which has got lots of unsaturated sulfhydryl groups. So more and more arsenic will now combine with ball. A chelate complex will be formed and it will be excreted from the body. What is the route of administration? Always intramuscular. Why? Because this British anti-lewisite comes in fatty acid oil. If you give it through IV route, fat embolism will occur and the person will die next 2 to 3 days. So we don't want the patient to die. We want the patient to be treated. That is why we give intramuscular ball injections. Now answer this one. 2 friends fought with each other over the issue of a female. Issue can be anything. One of the male pushed another and kept his feet over the chest of another person and put pressure over his airways with his hands. Now there are 2 things which are happening over here. What are the 2 things? Feet over chest, putting pressure over chest, which I can say is basically going with trauma to the chest, or I say traumatic asphyxia. This will lead to exclusion of air from the lungs. Asphyxia means exclusion of air from lungs by any means. If it is due to trauma over chest, we say traumatic asphyxia, external compression of the chest. And then the person is putting pressure over his airways. What are the airways? Mouth and nose. What is this called? This is what is called smothering. So 2 asphyxial mechanisms are acting together by the act of this fellow. And this act is being done to kill a person. So I can say it is an act of homicidal traumatic asphyxia with smothering. And what do you call this in one word? This is what is called barking. In the name of Barke and Hare. The story you all know. I am taking into account. Next time, suppose they give you a question that there is a newborn who has died due to accidental traumatic asphyxia and smothering due to heavily built parents sleeping besides the newborn. The hand of the father went over the chest and the hand of the mother went over the airways of the newborn. What is this in one word called as accidental traumatic asphyxia and smothering? Mainly seen in newborns. In such cases, a combination of these 2 events is now called as overlaying. Okay. So this was also one of the recent exam questions. Asphyxial death topic is very important. Always revise the topic nicely. Which of the following is used to identify the next question? Vaginal cells. What we need to identify is vaginal cells on the glans penis of accused, and the accused has done which offense? Rape offense. So we are taking penile penetration into vaginal orifice, peno-vaginal penetration. In cases of peno-vaginal penetration, if the accused has not used a condom, yes, female vaginal epithelial cells will be usually present over the penile shaft of the accused. So which test will help you to detect these vaginal cells? Answer goes with Lugol's iodine test, because these female vaginal epithelial cells, they are rich in glycogen. And this glycogen is a starchy substance. When it combines with Lugol's iodine, we get a brown color change and we see the test to be positive. Will this test be positive if the accused has used a condom? No. But there we will detect lubricant material from the penile shaft. that will be suggestive of uses of condom. So even if this test is negative, sexual assault cannot be ruled out because the accused might have used a condom. What is the use of precipitin test? This is a test to differentiate species of the sample. Species differentiation test. What is the role of Florence test? This is one of the microscopic tests to detect whether a white stain recovered from the crime scene is semen or not. Another test is Barbarios. So we have boyfriend test, B for Barbarios, F for Florence, to detect white stain sample whether it is semen or not. Toluidine blue is used to highlight micro lacerations of genitals. When do you say an injury to be laceration? When we see irregular margins, but because the injury is micron size, from the naked eye it is not visible. With a magnifying lens also you are not able to visualize. Now what we will do, over the genitals I will spray this toluidine blue. It will highlight the irregular margins, and now I will be able to appreciate, at least with a magnifying lens. So to look for micro lacerations of genitals, we use toluidine blue. All these are questions. All the options are also questions. And stain analysis is itself a very important topic for every exam, a VIP topic. Now answer this one. Features of cocaine intoxication are as follows. A, B, C, D. Some options are given. Select the correct answer from the options given below. Now true and false is something like it is framed in another way, asked in one of the recent exams. So what about option A, chest pain with asthma-like symptoms? Will it be seen in cocaine intoxication? Yes, true statement. Why? Because cocaine leads to vasospasm. Because of vasospasm, cocaine is the only local anesthetic which is vasoconstrictive in nature. It is vasoconstrictive in nature, and this vasoconstrictive nature can give rise to acute coronary spasms. Acute coronary, I'll be writing again, acute coronary spasms. Because of its vasoconstrictive nature, it can give rise to nasal septum perforation. Nasal septum perforation, that can also occur. Because of its vasoconstrictive nature, it can give rise to abdominal pain, which is a very common finding. Intense abdominal pain due to ischemia of stomach and intestine. Then it also leads to bronchospasm. The metabolites of cocaine, they give rise to features of bronchospasm in the patient or in the addict. So yes, the person will have chest pain with asthma-like symptoms. That is a true statement. And we know in relation to vitals, all the parameters are raised. Hypertension, cocaine leads to cocaine fever, just like atropine. Atropine leads to dry hot skin, same with cocaine. It also leads to cocaine fever. So hypothermia is also correct. What about constricted people and bradycardia? This is totally wrong, false. So A, B, C are true and D is false. A goes as my correct answer. Cocaine leads to mydriasis and it leads to tachycardia, not bradycardia. It leads to tachycardia. So these are some important features in relation to cocaine intoxication. Now try to solve this question. Is this question a tough question? A 40-year-old patient was brought by police in unconscious state to casualty with history of unknown poisoning. This is how nowadays questions are being asked. They give you the history of unknown poisoning. With the help of clinical features, you need to identify the type of poisoning, or they can ask you the treatment, or they can ask you the diagnostic test to be performed. So this is how we are covering in our classes also, na? How to, what will be the differentials of unknown poisoning presenting with these features. So suppose you see all the vital parameters to be raised. Suppose you see needle track ulcers over upper limb suggestive of IV drug uses. Then you are noticing vision loss. You are also noticing arrhythmias. Vision loss can occur due to mydriasis. This mydriasis can further lead to acute angle closure glaucoma. And yes, vision loss can also occur due to which poison? And which poison can affect CV system, leading to arrhythmias, leading to coronary spasms, and all the vital parameters raised? Out of these 4 options, you can easily say heroin cannot be my answer. Why? Because it is diacetyl morphine, opioid group of agent. Opioids will lead to decreased vital parameters. Based on these features, cannabis can be easily ruled out. Cannabis does not lead to increased blood pressure as such. So yes, I can say cannabis can also be ruled out based on these features of needle track ulcers and all IV drug uses. Cannabis intoxication is mainly through smoking route. Now we are left with cocaine and LSD. The best answer here goes with cocaine intoxication based on IV drug uses leading to needle track ulcers, because usually this cocaine is mixed with heroin. And what is this combination? IV combination of cocaine and heroin called speedball. This is one of the common modalities for intoxicating cocaine. What is the most common route of LSD intake? Most common route is oral, by using blotter paper which has LSD in it. So blotter paper, through oral route it is consumed. So LSD can be taken through IM IV route, but the most common route is oral. For cocaine, the preferred route preferred by the drug addicts is IV route, and we are getting needle track ulcers. All this is taking our answer towards cocaine poisoning. The vitals being raised, vision loss, arrhythmias, they are very predominant features seen in cocaine poisoning. Now what is this poison in the image being shown? This is how your cocaine plant looks like. What is the name of this plant? Erythroxylon cocoa. Erythroxylon cocoa. And cocaine is obtained from the leaves. From the leaves of this plant, cocaine is obtained when these leaves are treated with concentrated acids like HCl, H2SO4. We obtain the final refined product called cocaine, and that is why they are very costly. And in India, they are narcotic drugs: cocaine, cannabis, opium, and poppy straw. So that's all in this session. So do revise this session. You will revise multiple important topics. And best wishes to all of you. Keep up your spirits, keep on working, keep on striving, and you all will get very good ranks. Keep on telling that to yourself that I am rank number 1, I am awesome. And yes, God is there, na? He sometimes listens to your wishes. So all the very best. Bye-bye.